World Hepatitis Day 2020 is an important landmark for the hepatitis community. We are now just 10 years away from the 2030 elimination targets set out by WHO in 2016. With concerted effort over the next decade, we can eliminate this global killer and save millions of lives. Sadly, 2020 is also the year the COVID-19 pandemic gripped the world. This crisis has had a significant impact on the viral hepatitis community, with prevention, testing, and treatment services affected, and many people living with viral hepatitis facing difficulties in obtaining the care and medications they need. I'm acutely aware of how the pandemic has affected World Hepatitis Alliance members and your plans for World Hepatitis Day. But I also know the resilience of our membership in the face of adversity, and I have full faith that the hepatitis community will utilize every opportunity to raise awareness on July 28th. World Hepatitis Day is our day to speak in a united voice and to celebrate how far we have come towards eliminating viral hepatitis. It also gives us time to pause and reflect on the countless lives that have been lost to these diseases, despite there being a vaccine, an effective treatment for hepatitis B, and a cure for hepatitis C. This year, on World Hepatitis Day, the World Hepatitis Alliance and the No Hep movement are calling on policymakers to keep the promise they made to eliminate viral hepatitis by 2030. Viral hepatitis is a global health crisis, but one that can be overcome. Progress is being made. Over 124 countries have developed or are developing elimination strategies. However, many of these strategies do not have funding. WHA has just released a new report from India, Punjab state, which lays out the financial case for hepatitis C elimination. It shows that scaling up their response to ensure they reach elimination by 2030 is not only achievable, but is cost-saving. These financial cases are imperative as the world enters a period of difficult financial outlook. It will be far too easy for governments to do nothing. However, investing in hepatitis elimination now will save money, strengthen health systems, and avert over 7 million deaths. One of the easiest and most cost-effective interventions is the prevention of mother-to-child transmission, or PMTCT. On World Hepatitis Day this year, the WHO will be releasing new guidelines on hepatitis B PMTCT. This is an issue which is particularly close to my heart. As someone living with hepatitis B and a mother, one of the most important milestones in my life was seeing that the PMTCT interventions worked, and my children have all tested immune and they are hepatitis B free. I don't have to live with the burden of having passed on this lifelong infection to my children. It is unconscionable that with the tools we have available, there are still many children infected every year with hepatitis B. We must ensure that birth dose is given to all children. But that alone is not enough. All pregnant women must be screened for hepatitis B so that we can identify those who may need antiviral treatment to prevent transmission to their infants, but also for their own health. Countries must integrate hepatitis into maternal and child health services in order to protect their next generation. This also must be seen as a women's health and women's rights issue, because viral hepatitis elimination will not be achieved without gender equality. It is my sincerest wish that World Hepatitis Day 2020 is a catalyst for action, even in the face of the COVID-19 pandemic. Let us raise our collective voices and work together to eliminate hepatitis. Thank you for your commitment, and I wish you a highly successful World Hepatitis Day. Thank you.